Two projections, antero-posterior and lateral, are required at right angles to each other to demonstrate the full length of the radius and ulna to include both the elbow and the wrist joint. Post-ion of the patient. The antero-posterior projection with the forearm supinated demonstrates the radius and ulna lying side by side. A 24 by 30 centimeters cassette with high-resolution screens may be used and positioned to include both joints on one image. Both projections are normally acquired on one film. Direction and centering of the X-ray beam. The vertical central ray is centered in the midline of the forearm to a point midway between the wrist and elbow joints. Note: the postero-anterior projection of the forearm with the wrist pronated is not satisfactory because, in this projection, the radius is superimposed over the ulna for part of its length. Lateral, basic. Position of patient and cassette. From the antero-posterior position, the elbow is flexed to 90 degrees. The humerus is internally rotated to 90 degrees to bring the medial aspect of the upper arm, elbow, forearm, wrist, and hand into contact with the table. The cassette is placed under the forearm to include the wrist joint and the elbow joint. Direction and centering of the X-ray beam. The vertical central ray is centered in the midline of the forearm to a point midway between the wrist and elbow joint. Essential image characteristics. In trauma cases, it may be impossible to move the arm into the positions described. Both joints should be seen in the true lateral position. Patient position you see in the picture. Radiological considerations. When two or more bones such as the radius and ulna form a ring, fracture of one of the bones is often associated with fracture or dislocation elsewhere in the ring, especially if the fracture is displaced or the bone ends overlap. In Galizzi fracture, there is a fracture of the radius with dislocation of the distal ulna, while in Monteggia fracture there is fracture of the ulna with dislocation of the head of the radius. In forearm fracture, therefore, both ends of both bones, as well as the proximal and distal radio-ulnar joints, must be demonstrated. General forearm projections do not give adequate views of the elbow and should not be relied upon for diagnosis of radial head injury. If an elbow joint effusion is shown, formal projections of the elbow joint will be required.